Good afternoon, everyone, and welcome to the University of Michigan School of Nursing Health Equity Leadership Series. My name is Emily Herzog, and I'm the Epic Pathways Nursing Health Equity Scholars Program Coordinator here at UMSN. Thank you again for joining us. Thank you for being here. Thank you for being on time. So glad to share this space with you all. Our talk today is titled The Birth Detroit Story, featuring Elan Jaffrard, the co-founder and perinatal education and support director at Birth Detroit, and Dr. Jessica Flagger, midwifery education faculty and birth center midwife at Birth Detroit, also adjunct clinical instructor here at UMSN. The Epic Pathways program is co-hosting today's event in collaboration with the UMSN Midwifery Graduate Program. Dr. Ruth Zielinski, clinical professor and midwifery graduate program lead here at UMSN, will be moderating a Q&A following Elan and Jessica's presentation. So please feel welcome at any time to submit your questions using the Q&A feature in Zoom. As I stated, we are recording today's session, but only the speakers' videos will be recorded and shared. And we also stop recording once we start the Q&A portion. We've also enabled automated captioning, so feel welcome to enable captioning. I'm going to now pass things off. Is Elan here?
Yes, she said that she is.
Yeah. What a champion.
I don't know if you can see me, but I am here. Hello, hello.
Hi. Wow. I say what a champion, you guys, because Elan had some car trouble. So we're extra grateful you were able to make it. But I'm going to hand things off to you and Jessica to introduce yourselves, introduce Birth Detroit, and tell us the Birth Detroit story.
Wonderful. Thank you so much. And thank you everyone for being here. We are so happy to be presenting our story today, the Birth Detroit story. So like Emily said, my name is Dr. Jessica Flagger. I am a nurse midwife. I'm joined today by my wonderful sister in birth work and friend and colleague, Elan Jaffrard, and she'll be introducing herself just momentarily. But I'd like to start off just sharing a little bit about myself. I found midwifery as a career pathway during my time as an undergraduate student at the University of Michigan, my sophomore year in the nursing program. I've been a midwife for 9, almost 10 years here in Metro Detroit. It's such a blessing to be back here sharing the Birth Detroit story with you all. My current role is a birth midwife, a birth center midwife at Birth Detroit, as well as the midwifery education faculty with Birth Detroit. And that role encompasses being adjunct faculty here at the University of Michigan and supporting our current MyMat scholars, which are midwifery students from underserved and midwives of color from backgrounds of that matter. And we're just so excited to have them in the program. So yeah, I'll pass it off to Elan.
It is indeed my pleasure to be sharing this space with you and also with a sister, colleague, and dear friend, Dr. Flagger. But my name is Elan Jaffrard. I use the she series of pronouns. I am a public health professional in a former life, worked in maternal and infant health, and have worked as a birth doula for 10 years this year. So I've supported countless families in all birth settings. And my favorite births have always been attended by midwives. I saw my very first birth at age 5. And my mom was a U of M nursing, she's a U of M nurse alumnus, and was really concerned and wanting to see her children, her older children, see what normal birth looked like. And so I saw my baby brother born at age 5, and I knew that catching babies was my calling even then. And so I'm just delighted to be in this space. And I am a student midwife pursuing a certified professional midwifery credential. So coming with all the love for midwives today. I'm not sure, Emily, you're sharing your screen for us, yes? Oh,
Yes, I am. And I have your slides, so I'm gonna be the one moving them along.
thank you. So today we will plan to share with you how Birth Detroit came to be, um, what you can learn about what is the midwifery model of care and how it kind of differs from the medicalized system of care typically, and how it's been most impactful to marginalized communities, both in this country's past, in our present, and our hopes for the future. We also want to share with you what's happening in Michigan around birth center access for families in both peninsulas of the state. So just to tell you a little bit about who kind of founded Birth Detroit, and you can advance the slide. We began our work with an imagination. I want you to imagine walking into a space where your baby, your family, your partner is welcomed, that you are met by midwives who see you, who know you, who have been spending time with you through the course of your pregnancy. And then when it is time for you to give birth, they are there for you, supporting you, normalizing the experiences, both physically and emotionally, you may be feeling. And then I want you to span out. I want you to think about a world where birth is normalized and safe, no matter where you plan to give birth, that your family traditions are honored and considered sacred, that those who take care of you love you and celebrate you and those who are part of your family, no matter what that family looks like for you. Imagine giving birth into the hands of midwives in a community birth center, if that is where you choose, that is designed in response to your dreams, to the hopes and the needs of the community that you call home. We began every dream, uh, every system that we live in started as an imagination, started as a moment of thought. And I want to honor the three other women that joined shoulder to shoulder with me in early 2018, where we started to imagine a birth center in Detroit where one has never existed. Next slide, please. And so starting from your left to the right, we have Leslie Welsh, who we met along the way as public health professionals. Leslie formerly served as the Deputy Health Director at the Detroit Health Department. Myself, who again was in maternal child health, public health. Charlie Snow, who is our Chief Clinical Officer now, but formerly worked as Director of Midwifery Services for a large health system in Metro Detroit. And then Nicole White, who has supported our policy work, but is a licensed midwife, certified professional midwife in our state. We made a big vision, but to accomplish a vision, you have to have a mission. And so we named that we were to midwife, and typically the definition of midwife is to be with woman, but it also can look like bringing into being. And so we named that we wanted to bring into existence safe, quality, loving care through pregnancy, birth, and beyond for every person who desired that kind of care. And so we, on a volunteer basis, on the weekends, working our full-time jobs, being on call, supporting families, leading health system, leading work, we endeavored to dream this big dream. And who would have known we'd be here almost 6 years later, 7 years later. We started in 2018. Next slide. So we started by naming what it is that drove our work and the intention around equity. I formerly served as a health equity consultant, specifically around maternal child health. And so we lifted up the definitions from the former National Birth Equity Collaborative, which named birth equity or defined birth equity as the assurance of the conditions of optimal births for all people, with a willingness to address racial and social inequalities in a sustained effort. We kind of added to that definition, and in the work that I did in consulting, tweaked it to say that when we address the root causes of inequities, the isms, the ableism, racism, gender discrimination, and exploitation, to name a few, that ultimately removing the subsequent barriers and creating fair and just opportunities and conditions to achieve optimal wellness before, during, and after pregnancy and birth. We know pregnancy and birth don't happen in vacuums. And so in order to create a more just world, we must address the conditions, the systems, the intentional structures and their design in order to shift how people experience pregnancy, how people experience health and wellness before they become pregnant, while they are pregnant, and after they give birth, and thusly the whole lifespan. Next slide. So we asked our community, what do you need? Very rarely do you hear health systems or folks providing health services come into a community and ask them, is it safe to be here? What do you need this to look like for you and your health and your access? And so we asked our community first, what does this look like if we're imagining a birth center? Is it even something desired here? And so we polled over 400 people through a very grassroots effort. We shared the polls in focus groups with our local communities. I'm a doula. I shared it with my clients and former clients. And mostly Black Detroiters named that they wanted to see a birth center in their community, reflective of their culture, their experience, their racial identities, and named what those services should look like for them. And so some of the higher ranking services that they named were breastfeeding support and help, the ability to labor freely, um, being able to have someone come visit you at home after you give birth and not waiting for that 6-week visit, and then naming what is the provision of care look like for families in Detroit. So we were very intentional, specific, and we listened. Little did we know that we were going to embark upon a pandemic, which essentially separated partners from their support, for partners from birthing folks, that babies were being separated from their mothers shortly after birth. And so this kind of guided and shaped how we decided to execute building a birth center. Next slide. So in a short window of time, when we look back on it, it felt long. But in 2019, in response to our community, we held what we called a launch and learn. We invited Jenny Joseph, who is a midwife in Florida, who leads a great deal of national and international work around Black maternal health, perinatal health. And little did she know, she was kind of being a prophet to us, saying, you must start with care. She has developed a model in Florida to do easy access care. In traditional care, people have to typically wait until they're well into their first or even second trimester, depending on the busyness of the practice. And so many people don't get an opportunity to access care in the time that they need it. Or if they're later in care, are turned away. That's not uncommon. So we established that in 2020. We began doing childbirth education to prepare people for hospital-based birth or connect them to home birth midwives. We established ourselves as a nonprofit. And then we began to build ourselves through the generosity of our funders, through grants, through philanthropic efforts. So donations as small as $20 to donations as large as $1 million helped us to achieve our financial security to this point. In 2022, we launched our This Tea Builds a Birth Center, Builds a Black Birth Center campaign. And with those sales, we were able to purchase 2 of the 3 lots we own free and clear in the city of Detroit. And just goes to show that when a community desires something, when people build power, they can do amazing things. And so we broke ground in 23. We completed our building late last year and took occupancy at the end of last year. And now we are here providing care and service. Next slide. So this is just a rendering. The picture to the far left is our amazing board of directors. So as a nonprofit, we do have a really wonderful, influential board that support us in continuing to build our sustainability and to support our leadership as we continue to think innovatively about how we continue to do our work. And these are just some of the beams during construction that we as a team went into our construction and began to write on the beams that love is truly infused here. And so we have lovingly called our first phase of our birth center, the birth center that love built, because truly it has been acts of love, acts of generosity, acts of determination and intention that have built us literally from the ground up. I'm going to turn it over to Jessica. I think you take it from here, Jess.
Thank you. Next slide, please. So thank you, Alon, for laying that beautiful pathway for how we got to where we are right now. We also feel it's incredibly important anytime you're looking to the future to also know from where you came. And the timeline of modern midwifery in the United States, while midwifery may be incredibly popular and increasing in popularity today, we know that midwifery is not new. Black midwives, specifically granny midwives or grand midwives, what we prefer to call them, really laid the foundation for midwifery in this country when they arrived here from Africa. They brought with them traditions, history, rituals, medications, herbs, just a wealth of knowledge that they shared with both Black and white families here in the United States. And we know that they really laid the foundation for the work that we're currently doing today. And while their work was incredibly beneficial, they were oftentimes the only providers who would take care of African-American families. At some point in time, greed, racism, and sexism took over. And in 1910, the Flexner Report was written, which in essence encouraged medical education to be moved towards institutions such as universities and schools. And this decision essentially limited access to medical education for a lot of people. Next bullet, please. And then in the 1920s and 30s, there was a multifaceted campaign against midwives, specifically Indigenous midwives and midwives of color. This smear campaign essentially said that midwives were unclean, unsafe, unhealthy, and that it would be better for people to give birth in the hospital compared to in the community setting. This shut down a lot of the work that the grand midwives were doing. And during this period of time when the work was shut down, a lot of that knowledge that they brought was lost. This knowledge was not brought into the hospital. So it was a lot of experimentation, a lot of new things that were happening to women in the hospital that was not always evidence-based. However, we did see a shift in the movement in the 1960s and 70s when women started to reclaim their birth stories and reclaim their birth experiences. Next slide, please. So the midwifery model of care, as we know it today, is a wellness model. It is rooted in the health and well-being of the clients that we serve. We work in partnership with our clients to determine what health means for them. We see our clients as whole people. We want to understand who they are in the context of their families and their communities and their social settings. We truly value continuity of care. So especially at Birth Detroit, we value seeing our clients from their very first prenatal visit all the way through their postpartum. And we understand that this helps us to get to know our clients a lot better. So that way we can identify any changes, anything that's abnormal, and also uplift them with their health and their wellness and their well-being. And we also really strive for reproductive justice, making sure we are uplifting reproductive health care, and just honoring those who choose to have children, who choose not to have children, and making sure that they can parent their children in a really safe, loving, and healthy environment. Next slide, please. There are many different paths to midwifery. Ruth will touch on this a little bit at the end of the presentation. In this country, there are certified nurse midwives, which are traditionally midwives who have a bachelor's of science in nursing and then go on to pursue a master's of science in nursing. They can also follow through with a doctorate of nursing if they desire. And these midwives typically work in the United States in hospital systems. They can also work in out-of-hospital settings like I do in a birth center. And they can also do home birth if they choose to, but the majority of certified nurse midwives in the country work in a hospital setting. There are also direct entry midwives, which are certified midwives and certified professional midwives, who also receive specialized training and mainly work in out-of-hospital settings. And then there are also traditional midwives who tend to take a more of an apprenticeship model towards becoming midwives. Next slide, please. We really want to drive home that community birth is a safe option for low risk and healthy clients, and everyone deserves safe birth options. It's incredibly important for a community birth like birth center and home birth to be integrated into the medical ecosystem, so that way there is a true understanding of what we do in the community birth world within the medical complex. We also want to increase safe access to promote birth equity and reproductive justice. And we want to address obstetric deserts. So in the state of Michigan, about 30% of the state is an obstetric desert or an area that does not have an obstetric provider. So by increasing access to community birth, we're able to expand our reach and help as urban as well as rural communities get the much needed midwifery care that they need. Next slide, please. Send it back to you, Alon.
So naming that the type of care a person receives and how a person is cared for really can change how they not only experience their birth or their pregnancy or their reproductive health care, but it shapes how they experience life as a parent. And it does matter how you give birth, and it does matter how you were born. So birth center care centers and values culture as a strength, that racial concordance does have its place with other levers in mind. So it doesn't just matter that I am Black and my client is Black. It also matters that I understand their context. I understand from where they're coming from, and that there is time to build relationship and trust. And birth centers allow for those types of visits to happen, as well as, again, setting an expectation for the client, not just to be the center, but the leader. Racial justice has its place, and many times people ask us, how does racial justice manifest itself in healthcare? When we know that in this country, and again, this is an example of inequity, something that is measurable, pattern, and systemic. That if I were to plot the same values, the same patient or client demographics in any country, in any state in this country, that their outcomes would be the same or similar. Racial justice is essential to ensuring that not only our families who come to us for care are safe and supported, but also that their babies have a greater likelihood of health beyond the first year of life. Physical and emotional safety do matter. In many times in health systems, when we talk about safety, we're often talking about physical safety, or we're talking about prevention of morbidity or mortality. However, emotional safety, again, shapes a person's experiences, their births going forward, their outlook on their own experiences. And we, again, in a birth center setting, work very diligently to create that, because we have the time to do it. Improving the experience of autonomy and respect, again, a very high touch, high quality approach to care, not just in the birth moments, the labor moments, but also along the way. Even if a person risks out of our care, being able to gently warm them to a higher risk provider, or again, creating those educational moments because we have the time to do it, really allows us to remind people of their power, not to empower them. I certainly believe that we all have power. And oftentimes when we go into certain structures and systems, that we're reminded we don't have much power. We feel quite powerless. And so a birth center is built, it's designed, it's model of care, it's how the providers are even trained and approach the work, is to center one's autonomy, and health efficacy too. And then overall, and this reminds folks that their experience does matter, and thusly we've removed barriers and create more opportunities to create the conditions for not just safety and wellness, but the equity that we defined earlier. Next slide, please.
So on this slide, you will find a photo of one of our beautiful birth suites that we have at Birth Detroit. Some of the benefits that birth centers provide is a more family-centered experience. We know that babies are not born into a silo or a vacuum. They are born into a family. And at the birth center, families are encouraged to be a part of the birthing experience. We want children to be at the birth. We want grandparents and fathers to be a part of the birth. So we truly encourage whoever the birthing parent wants to be with them in the birth, to be a part of it. We view ourselves as a maxi home. So imagine giving birth in a home-like environment in your home, but also having access to your midwives, to certain medications if you were to need them in the case of an emergency. We approach birth as a normal physiologic event. We believe that our clients are capable of birthing their children in a safe and healthy way. And all the decisions that we make will support that normal physiologic labor and birth. And you go home a lot sooner at a birth center than you do traditionally in a hospital. We know that you rest and recover a lot quicker when you're at home and when you're in your own environment. And as long as everything went beautifully with the birth, we encourage our families to go home as early as 4 to 6 hours postpartum, whereas in a hospital setting, you're there for at least 24 hours. We have very frequent surveillance. We're back in the home within 24 hours to make sure that everything is going okay. But we know that breastfeeding happens a lot smoother when you're at home and when you're comfortable, when you can eat the foods that you're used to eating. And so the birth center is able to provide this wonderful home-like environment for this very normal physiologic process that's happening. Next slide, please. So we'd just like to walk you through what a typical client at Birth Detroit may experience during their pregnancy. Once they are accepted into care, that means that as the midwives, we've reviewed their health history, we've met them at open house. Once they are one of our birth center clients, during their prenatal care, they receive comprehensive prenatal care. So all of the tests, the labs, the ultrasounds, everything that you would typically have in a traditional, out of hospital, in hospital setting, we also do in the birth center. So our clients do not have to travel to a hospital for anything during their pregnancy. They have 24/7 access to the midwives for emergency needs. They can call us and we pick up the phone. There's no middleman, there's no answering service, it's us directly. And I think this helps for them to feel really connected to us as midwives, for them to know that we are always there no matter what. We have wonderful childbirth education classes that are geared specifically to delivering outside of the hospital, because we know this is a very special and unique experience, and all of the amenities that the hospital has to offer, specifically with pain medication, aren't available in the birth center. So we want to make sure on the front end that all of our clients are prepared for that experience. And we also have a relationship with lactation consultants that can meet with our clients prenatally to tackle any fears, any issues, anything that may come up regarding breastfeeding before they actually attempt to breastfeed. And we know that this will improve our breastfeeding outcomes for our families. They will see one of the 3 midwives during their pregnancy, and they're encouraged to meet all of us because, as you can see, when it's time for birth, there will be 2 midwives at their birth and a birth assistant. One midwife is dedicated completely to the client and supporting her laboring process. And once the baby is born, the other midwife is completely dedicated to the baby. So we want to make sure that everyone is having a safe and loving and warm experience. Our clients are in communication with us when they're at home in early labor, and we mobilize to the birth center when we believe that it's time for birth. We offer natural birthing options, and we support normal physiologic birth by having a tub. In a lot of hospitals in Michigan, water birth is not allowed. It's not something that they practice. A lot of hospitals have tubs, but when it's time to give birth, the parent has to get out of the tub. And we are the only place in Detroit that offers water birth at this time. So we're very excited, as you can see in our photo, one of our lovely midwives is in the tub. We're very excited to offer that to our clients. And like we said, during the postpartum period, once you go home within that 4 to 6 hours, we really, really we're intentional about following up with our clients in the postpartum period, because we know that typically in a hospital setting, you have one visit, traditionally 4 to 6 weeks postpartum, but so many things can happen during that time that can be missed. And one of the reasons that our maternal mortality rate is so high is that no one checks on these moms in those first 4 to 6 weeks. So we've designed our check-ins to be a lot more frequent. We're in the home at 24 hours postpartum. We're checking on mom, but we're also ensuring the health of the baby, doing all of those routine newborn screening tests that you get in the hospital, outside of the hospital. We are providing support for breastfeeding. So just like our families had 24/7 access to us prenatally, they also have 24/7 access to us in the postpartum period. So they can pick up the phone and say, you know what? I don't think the baby's latching, or it's really uncomfortable. And in that moment, we can also mobilize our lactation consultants if need be. And we provide that normal newborn care until they transition into their regular pediatrician. So all of this was incredibly intentional. We hold our families very close. We want them to know that we are here no matter what. And we believe that all of these things will be reflected in our outcomes as well. Next slide, please. So we believe that the spirit of the care that we provide is what keeps us going. It's what keeps our clients coming back to see us. We want to honor the midwives that came before us that worked so hard to hold our community. Without them, we simply wouldn't exist. So we want to make sure that we honor them in everything that we do. We meet our clients where they are, and whatever they need, we work to provide that. Like I said, we hold our clients very close to our hearts, and we uphold our core values of safety, love, trust, and justice. And this is something that we believe is unique to our birth center experience. And as much as we love, numbers and science, sometimes it's the spirit of the care that you provide that keeps everyone safe and healthy and full term and alive. So this is what we, provide, and we're very excited about it. Next slide, please. Back to you, Ellen.
So where are we going? Where are birth centers going? So I would be remiss if I did not honor and mention that Michigan does have birth centers. Metro Detroit has birth centers. However, we are the first Black-led birth center. We are one of very few, I believe we're one of two nonprofits in the entire state. And so we really, again, set our intention around supporting clients because birth center care historically in Michigan has been a non-reimbursable service. So most folks are coming, paying out of their pocket some portion of their cost. Depending on the birth center, there's typically a scale if a person is a Medicaid eligible client or a Medicaid recipient. However, we built Birth Detroit with those who have not traditionally been able to access this kind of care because of costs. So we do accept Medicaid, and again, we have a whole process for that. But we are, for Birth Detroit specifically, we are continuing our care and programming. We're expanding the number of hours of service. We were formerly given in-kind space through our easy access care pathway, so people can get prenatal care with us, still give birth in a hospital. And then we now have birth center, prenatal and birth care available. We've always offered education for new parents and expanding that program to support parents before and after their babies are here, both parents. If there's a father involved, we want fatherhood support for those dads. And then just yesterday in Michigan, birth centers are now licensed facilities. What does this even mean? So licensure is one step closer to being able to bill or be reimbursed for your care facility. I don't think I mentioned at all that Birth Detroit, as long as we've been providing care, has I think up until last year, has not been reimbursed by any insurances. And simply it's because of how traditional reimbursement and payment has been structured in our country. And so this is such a warmly welcomed new legislation. And I'm so proud that these policies came to be as a result of the contributions of community and stakeholders, especially those who are providing the care and receiving the care. So we have a lot of work to do to bring awareness to our communities across the state about the impacts and the positive help that birth centers bring to their neighborhoods and their communities. And so we're launching a larger campaign around awareness and education. And then we encourage all of those across the state, across the country, across the world, following our journey, support our journey, buy a t-shirt, watch us, follow us on social media, be inspired, because we know that our prayer is that our ceiling is your floor. As younger people, as a new generation, consider midwifery as perhaps the next iteration of your career. If it's okay, before we take questions, do we have a time for a 3-minute video, Emily?
Yeah, absolutely. Let me just modify my share settings so that the audio comes through.
Okay. I'm gonna, if it's okay, I'm happy to share my screen as well, but we did want to share a story from a family who received easy access care with us. So they gave birth, I believe they were at U of M Hospital, but they gave birth at a hospital with a doula, but got midwifery care through Birth Detroit. And they're some of our favorite folks. So I'm gonna just send the request to you, Emily,
Oh,
to
yeah,
share
sorry.
my screen. No worries. Got it. Perfect. So please hear the story of Tish and Miranda.
I really wanted a family setting. I wanted to make sure that we were picking somebody that we felt comfortable with. So I hopped on TikTok of all places.
Yeah, found Birth Detroit.
I found Birth Detroit on TikTok. I didn't find out a lot of the information about just the process in general until we were in the process.
Absolutely, yeah.
Yeah, I didn't know anything about a birth center.
We were so unfamiliar with like birth centers and it being available for like, you know, people like us in the city of Detroit. I didn't really know the difference between like a doula or a midwife. So I just didn't really know really what to expect.
We had some different experiences before reaching them as a same-sex couple, and they were just extremely welcoming. I can't thank them enough for just the experience that they gave us, honestly.
We called them and we spoke with Elicum, and she was just so welcoming. She just was like, we will pick you up, like we will come and get you. So I think from that moment we were like, yeah, this is good. We don't look after that anywhere else. So I remember our first appointment was in their back room, and it was like a children's room, which is like really important for us to just see. Like we kind of felt very welcome.
Yeah, it's not like a scary white box hospital.
And especially as like a same-sex couple, on top of being Black women, that was important for us too. You know, we wanted to feel like, we just wanted to feel regular, and they provided that for us. I did not know I was in labor the morning of, and ironically, she actually came on her due date. That morning, we actually had a 40-week appointment with Birth Detroit, and we went to the appointment. And at that point,
the contractions were really
they were coming.
Our midwife, Elicum, encouraged us to labor as much as possible away from the hospital and at home.
I contacted Erica and I was like, I think I should go in. And she was like, trust your body.
Yeah.
And at that point, they did admit us, and we got enrolled. And we started our birthing journey. And Erica was just like a family member that was just there that could, you know, speak up for me. And there was a situation where like I didn't know if I wanted my water broken or not. I just trusted her. I just trusted her to advocate for us and to help me make these decisions, to tell me my options, epidural or not. And yeah, so that was a very beautiful, I think, shared experience.
I didn't realize how much support that I needed.
Right, as a supporter.
As a support, yeah. And she just came and she asked me if I was okay and did I need to be relieved. And I just felt like I didn't even know that was supposed to happen. Like, you were checking on me. I appreciated that a lot.
So after we gave birth, Erica definitely came over to the house. She checked on us, so she kind of maintained our relationship after. I think the support that Birth Detroit provided, such a positive experience. I would want, you know, mothers to have the birth experience that Birth Detroit provided for us, to be able to know what's happening, be in control of your body, and also have that support.
Thank you. So we're happy to take questions. We want to honor where this picture came from. This is from the Birth Center Equity Fund, led by one of our co-founder, Leslie Welsh. But this is how we imagine the future to be, how we all come around this next generation of parents and of children, to remind ourselves that we're not new to this, but we're true to this, and that everyone deserves a village, a love, support, and justice and honor. So thank you all for the time, and we welcome questions.
Yeah, such a beautiful photo.
Thank you so much, Jessica and Elon. And I really appreciate today a little, bit of encouragement, a bit of a bright light. And when we start to think we've got, the work to be done is just too much. So I'm going to go straight to the questions. And the first one I got in the